I'm speaking to Dr. Vas Narasimhan, who is physician scientist and CEO of Novartis. Dr. Narasimhan has focused his education and career on improving human health and on his personal purpose of inspiring a healthier world. During and after his medical studies, he worked on public health issues such as HIV/AIDS, malaria, and tuberculosis in India, Africa, and South America. Through his leadership, Novartis has committed to expand access to innovative medicines in low and middle-income countries by at least 200% by 2025. Hello, Dr. Narasimhan.
It's great to be with all of you today and be part of this incredibly important video series.
How has the quest for global health equity impacted your career?
For me, as a public health physician who started his career working in hospitals in Africa, looking at malaria patients, trying to work on the first antiretroviral program in Botswana for HIV/AIDS, having had the opportunity to work on major initiatives at the World Health Organization, it shaped in me a very strong belief that we need to work tirelessly to improve health equity on this planet.
And how has it impacted your work at Novartis?
I have a strong belief that a company like Novartis can really meaningfully contribute to health equity by providing broad access to our medicines around the world. History at Novartis goes back many decades. Even in the 1940s and 1950s, we worked to build a network of health centers across Africa through our predecessor companies. Throughout the 70s, 80s, and 90s, we tirelessly worked on major drug donation programs, including providing the world's supply of leprosy medicines, as well as work on other infectious diseases. Then around 1999, we brought forward Coartem, one of the most important medicines in history to treat malaria. With Coartem, we have distributed over 1 billion courses now, reaching hundreds of millions of patients across Sub-Saharan Africa and other regions of the world, demonstrating the impact of how when we innovate a new medicine and have a systematic approach to access, we can have a dramatic impact on public health.
What role does industry play in advancing health equity, and how central of an objective should it be for companies?
For companies to have the impact we'd like to have on the world, we have to think about all of the sources of capital that we need to manage. Those sources of capital are, of course, areas like financial capital and intellectual capital. But equally important, more and more I think companies are realizing, is the social capital that we need to ensure exists in the world. We need to be a part of the solution for some of the biggest challenges facing the planet, whether that's in the environment or whether that's in health and health equity. We have to keep thinking about how can we design medicines that can be used broadly around the world and come up with access programs to enable rapid and fast access to make a difference.
Thank you, Dr. Narasimhan. We've talked a great deal about creating global health equity, but it's also important to look at why equity is missing to begin with. Why certain populations are missing the resources they need. Often, to start to address inequities, we have to look at, acknowledge and address the root causes, the systematic causes of these inequities. I'm speaking to a true legend in public health, Dr. David Satcher, a 4-star admiral in the United States Public Health Service Commission Corps, served simultaneously as the 6th Surgeon General of the United States and as Assistant Secretary for Health in the Department of Health and Human Services. Over his impressive career in public health, he has had other major leadership roles as Director of the U.S. Center for Disease Control and Prevention and Director of the National Center for Primary Care at the Morehouse School of Medicine. Since then, he has become a fellow at the Kaiser Family Foundation, established the Satcher Health Leadership Institute at Morehouse School of Medicine, and co-founded the advocacy group African American Network Against Alzheimer's. Thank you so much, Dr. Satcher, for joining us and for all your contributions in generating equity in our world. Dr. Satcher, we've been talking a lot about creating global health equity, but we want to understand how inequities develop. What can you tell us about the social and economic determinants of health and how they contribute to inequity?
Without health equity, there will always be barriers to all of our health. We live in an environment where each of us is impacted by the health of others. I had the opportunity to serve on the World Health Organization's Commission on Social Determinants of Health and came out with the report defining social determinants of health as the conditions in which people are born, in which they grow, and they're educated or they work. All of these conditions that surround our lives and engulf our lives are the social determinants of health. I think we had not been dealing with social determinants as major barriers to equity. And so I think since that time, our work has incorporated dealing with social determinants of health. And that's led to things like the political determinants of health, because if you're going to change the social determinants of health, you got to change policy. It's a major step forward, I think, to identify social determinants of health and from the beginning to target them as something that we can change. A good example, of course, is, some of our children, we're concerned about their nutrition, we're concerned about their physical activity. But some children live in communities where there's no safe place to play and they don't get good nutrition. So we have to change all of those conditions.
Why should we care about addressing systemic racism?
Well, I think racism contributes to health inequities. I grew up in Alabama during a very difficult period of race relations. I remember having saved my pennies, and I couldn't wait to go to town with my brothers for the first time. I was going to buy this ice cream cone. I just had this in my mind, I'm going to buy an ice cream cone. So we went to town. I slipped away from them, went into the drugstore, and enthusiastically asked the person behind the counter for an ice cream cone. And they said to me, "We don't serve," and I won't use the word he used, but basically we don't serve blacks in here. When you're 4.5 to 5 years old, and somebody tells you that, it sort of starts you on a path of doubting yourselves, and just a lot of things happen when you first experience that kind of racism. It was a shock to hear that. But that would not be the last time, of course.
Thank you so much, Dr. Satcher. As humans, we are wired to believe there exists a separation between you and me, between your family and our family, your tribe and ours. We tend to instinctively default to the idea that what happens to other people doesn't directly affect us. Yet, this could not be more untrue in our ever more interconnected, rapidly globalizing world. The human race is a single organism struggling to survive in a hostile universe. If we are going to make it, we have to become our own better ancestors together. Thank you for joining me in this series. To share your experience and wisdom with others, I encourage you to explore and contribute to 9lessons.org throughout your journey to becoming better ancestors, and as you go on to create positive change in our world.